The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thanks a million for joining us on this Health One Lunch and Learn webinar on CDM. First things first, on behalf of everybody at Clonwilliam Health, we'd just like to say a huge thanks for the hard work that you guys are all doing in these unprecedented times, and we appreciate you. We're here to help as much as we possibly can, and we're just all trying to do our bit really to get through it. So sorry, without further ado, my name is Donald O'Neill and I'm the head of marketing for Clonwilliam Health. With me today I've Glenda O'Neill, who is our Health One trainer, and Glenda's going to run through a quick overview of the CDM functionality in your Health One system. So I will just pass the controls over to Glenda, and Glenda, you can take it from there.
Great. Thanks, Donald. So can you see my screen, Donald?
I can indeed, yeah.
Perfect. Okay, so hi everyone. So I'm just going to run through quickly this is just a presentation I have just around the contract. So you're probably all well aware of this now, but I'll just kind of give you a quick brief overview on it. So first off, what do we need before we start using the chronic disease management in Health One? And the first thing you need obviously is to sign your contract and send it back to the HSE. Once you have that contract, then you need to make sure that you have a health link certificate on your machine. So if you don't have it, you should have a health link certificate at this stage, and you'll know you have one if you're able to download your bloods, basically. And I'm sure everybody at this stage is doing that now. So, but if you don't have a health link certificate, contact HealthLink directly, and they look after you there. The last thing then from Health One is just to make sure that you're on the correct version. So just make sure you're using version 8.7.1.26 or above that. So, and if you're not sure where you're or what version you're on, if we just go into Health One, and if you just say help and about, and here you'll see your version 8. So I'm on 2634. So 8.7.1.26 or what was the one, your one that you need? It is 26 or above. So, and if you need to update, you just do your help and your web update here, and that will update you to the latest version. So I'm in a patient here now. So you're all familiar with opening a patient. We're not going to go into that much detail. So you can see I'm in Deirdre Diabetes, and she's 78 years old. So the chronic disease management obviously is for over 75s. And I'll just go back to the contract just for a second here, just to show you this. So these are the conditions basically that are covered under the chronic disease management. So we have diabetes type 2, COPD, asthma, atrial fibrillation, heart failure, stroke, TIA, and ischemic heart disease. So they're the conditions that are covered. And then the second slide here just shows you the ICD codes. But when I go through it in Health One will automatically code the condition if you select it in the correct way. So if you select it from the dictionary. But we'll look at that in Health One. The next thing then is, so the contract, so what it says, so the contract basically is 4 structured visits to the GP practice in a 12-month period. So it will be 2 visits and a submission, and then you'll repeat those 2 visits again 4 months or later again, and you'll do the same thing. So usually like the way it will work will be maybe, I have kind of another slide down here, is a visit. The first visit will be kind of like the registration, and it might be with the nurse, and the nurse might take the bloods and do the review, and then the patient will go away, and then when the bloods come back in, the patient may see the doctor for the second visit. So the doctor will maybe review the first visit, have a look at the bloods, and then it will be submitted after visit 2. So then after 4 months then, you'll have visit 3, and it'll be pretty much the same as it was the first time around, and then you'll do visit 3 with the nurse, maybe take the bloods, and then visit 4 will be the doctor reviewing the third visit and submitting. So just to be clear on that. This is just saying there's 2 scheduled reviews in the year, and I'll come back to that. Okay, so we go into Health One now. So we'll start. So I'm in my patient, I have my consultation open, and I'm going to go to my Mediform. So you're all probably familiar with the Mediform. So we're going to insert a form. So I'm going to click on the red plus here, and I'm going to search for my CDM Mediform. So chronic disease management, or CDM. So I'll type CDM in, and you can see straight away Health One has found the CDM Mediform. Now, if for any reason you don't see the Mediform there, just go down to your all forms and just click on all forms, and it might be in that listing there, and just make sure it's ticked on, and that will then appear then in your My Forms. So we'll go back and we'll just say OK to open up. And the first time we open up the form, we're into the chronic disease management registration. So this is where we register the conditions. So we can see over here in the patient's problem list that this patient has a condition of diabetes mellitus type 2. So what the form has done here is it has pulled that in here. So it's pulled in the diabetes type 2, and they also have a condition of COPD. So it has also put that on there. So just to explain the registration form, you have your review date here. So that just pulls in today's date and the ethnicity. So for you here, if there's another condition, so if we look into the patient's problem list here, they had a stenting and an endarterectomy, which means that they have ischemic heart disease. So I'm going to tick on ischemic heart disease, and I'm going to say what date they were diagnosed with that condition. And in the date, you can put in the full date, you can put in a month and a year, or you can just type in a year. So I'll just type in 2002 there. So you can see there, you just tick on any boxes and you'll just press OK to register. So that will be the registration part. So that's registering the kind of the conditions in Health One, and we press OK. And the next part of the form now will pop up. Just give it a second there. And we're now into the chronic disease management review form. So this is where we're probably going to spend most of kind of today's webinar. So you can see here, we can just ignore this. I'm in a test patient here, so it's saying they're not a GMS patient, but they usually, they usually would have a valid GMS number. The last review then here, because this is this patient's first review, there is no last review, but it would be there if they'd had one before. And then you can see here the current CDM diagnosis. So what diagnosis do they have? So you can see that it has the diabetes type 2, it has the COPD, and it has also got the ischemic heart disease. And if you look over here into the kind of the problem list on this side here, what Health One has done is, because I ticked it on in the registration form, it automatically put it into the problem list here for me. So if I need to go back into that form at any point, I can click onto this diseases link here. If I click that, it will bring me back into that registration form, and I can, I can check there and I can tick things on. But just to be aware that when you tick a condition on here, it will automatically put it into the problem list over here. So, and like I say, you can go back into that form at any point with this icon up here. So just to explain how the form kind of works. So the form is very similar to your cycle of care form. You can fill in all the information. You can scroll at the side here. So you could, you could scroll up and down the form. You can arrow down to move yourself down through the form. Or over here, what we've done at this time around is we've kind of sectioned the form into different sections. So just to make it easy for you, if you're in the physical examination, you can click physical examination and you can fill in all the kind of the questions around the physical examination. If you click risk factors, what it will do is it will bring risk factors to kind of the top of the form and allow you to fill it in, etc. So when you see over here, they're in this red color, meaning that there's fields outstanding. So there's fields needing to be completed in, mandatory fields needing to be completed in all of these sections. And it tells me down here, 37 fields are required in total. So as I start populating the fields over here, this number will start reducing down. And these will turn blue as I kind of complete them. So once the physical examination section is fully completed, it will turn blue here. So the next thing I just want to explain is this part here, the responsible doctor. So in your system, when you open it up, hopefully what will happen is, if you're logged in, the doctor's name will be here, his GMS number will be here, and his IMC number will be here. And the way Health One is populating that field is, populating those three fields, Health One takes the patient's GMS number and it sends it off to the PCRS website. And what the PCRS does is it sends us back the doctor's GMS number. So when the doctor's GMS number comes back from the PCRS, Health One then looks into your user DB and it checks to see, is that number against any doctor in your user DB? And if it is, it will put that doctor's name into this listing here. Now, if for any reason you don't have the GMS number against the doctor in your user DB, then what will happen is when the PCRS send the number back down and it doesn't find any doctor, what it will do is it will just give you a drop-down list here, and that's what it's done here for me. I'm in a test system. This is the only doctor I have. So if I can then choose the doctor from the list here. The other thing that you might see is you might have that GMS number, so that doctor's GMS number against several different doctors in your user DB. And if that is the case, again, you'll get a drop-down list here, and you can just choose whatever doctor kind of is responsible for that medical card. So whoever the doctor is that's responsible for this patient's medical card is the doctor you want to select on the list here. So I'll pick Dr. Admin, and you can see there it's automatically pulled in my GMS and my IMC number. So that's the first part here. So the next thing then now is the physical examination. So the height is 157 centimeters. I'll put in the weight, let's say 77 kilos. And it automatically calculated the BMI. I'll do the waist, say 121. I'll do my heart rate of 77. I'll do my cardiac rhythm of regular. My systolic blood pressure, I'll say 124. And my systolic is 96A. And you can see what Health One has done over here. It has kind of prompted me, it has given me this kind of hint to say that this patient has mild hypertension. So that's just because of the information I put in here. So that's just a nice little feature there. So we move down now onto the physical examination diabetes. And the reason I'm seeing this physical examination diabetes is obviously because he has diabetes in his problem list and because we registered diabetes up here. So the form changes based on the conditions you have registered. So if the patient didn't have diabetes in the registered condition, then you wouldn't see this diabetes section here. So as I say, it changes based on the information you put in on the registration screen. So the first thing is diabetes relation amputation. So has the patient had an amputation? I'm going to say no here. So I'm going to just fill in this form just so you can be familiar with yourself with how you fill it in. And you can see as I begin to fill it in, it changes from the red exclamation mark to the little blue circle, meaning that I've completed that field. So I can see that's done now. And now I'm just going to say, tick these boxes. So, and again, this is all completed here. And then I'll say retinal screening in the past 13 months, and I'll just say yes there. And it's gone blue. And what else has happened up here is now you can see the physical examination, because it has completed, it's now turned blue here. So it's telling me I've completed all the mandatory fields in this section. So you can see down here, risk factors is the next section. And I could scroll down if I wanted to fill in the risk factors, but it's just easier just to click the link over here. And what it will do is it will bring risk factors to the top of the form here, and I can start filling in again. So it's pulled in the BMI. So I'm just going to, was there brief intervention given? Let's say yes. Their smoking status, let's say never. So their alcohol risk score, their audit C score. So in this case, it has the little kind of search icon there. And what it will do is it'll open up the audit C risk Mediform. And so I'm going to say, how often do you drink? So we'll say 3, and it's automatically put in an audit C score. So once we have the audit C score, at this point we can say okay, or you can go ahead and you can fill in this Mediform if you want to. But these fields are obviously not mandatory. Because the audit C score has now become 4, it has obviously given me more questions that I can fill in here. But as I say, for the chronic disease management, this is not mandatory. Once I have my audit C score, I'm okay. So I'll press OK, and you can see it's put in the audit C score of 4. So physical activity, in a typical week, how many days of physical activity? So I'll choose here, so let's say 1 to 4 days. And you can see what happens with the form is, depending on the answer that you put in, sometimes what will happen is it will trigger another question. So it will depend. So some of the fields, as you put an answer in, you're going to get more questions there. So we'll choose this and we'll say no, and you can see it's giving more there. So giving brief advice. So the vaccines then, so what the vaccines will do is similar to what the diabetic cycle of care Mediform would have done. It will look into the file and it will say, has an influenza vaccine been given in the past 12 months? And if it has, past 10 months, sorry, and if it has, it will populate this field here. So in this case, I'm going to say yes, and I'll put in the date the vaccine was given. If I'm not sure, I can go over to the vaccine history here, so I can use this little icon here and I can click in, and this will show me the patient's vaccine history here. So I can very easily access the different parts of the chart that are needed for the different questions with the click of a button there. So the pneumococcal vaccine will look back into the chart and see, has there ever been a pneumococcal vaccine given? And if there has ever been one given, it will say yes, and the date that the vaccine was given on. So the next thing then you can see again, like the last time, the risk factors is now turned blue because I have completed this section of the form. And I will move on to my disease assessment. And again, I could fill it in here, or I can just click to bring it to the top of the form. So my disease assessment has moved up here, and my CVD score. So I want to click to calculate my CVD risk score, which is the Q risk score. So I'll click on the little search. And that takes a couple of seconds. It's just opening up another Mediform there. So just give that a couple of seconds to open up. And you can see there's the Q risk. It has populated it with all the fields. And I'm going to calculate what this patient's Q risk score is. So it's given me the Q risk score, and I just say OK. And it automatically feeds it in here. So because this patient has COPD in my diagnosis, it's asking me for their dyspnea score. So if I click on the drop-down list, and I can say dyspnea with strenuous exercise, for example. And again, disease management has turned blue, and we're into investigations. So has the patient ever had an ECG? So I could say yes, no, or not available. So at this point, I might not know if this patient has ever had an ECG. And if I'm not sure, what I can do is I can click this little button here. And what this will do is this will search the chart to see, is there any mention of an ECG anywhere in the file? And in this case, you can see that he had an ECG in 2003. So I can say close to that there. So they have, yes, I can say yes to that. And the result was sinus rhythm, say. And the same again, has the patient ever had spirometry? And if I'm not sure, again, I click the little icon here on the side. It will open up Health 1, and it will look in Health 1 to see, is there any mention of spirometry anywhere in the file? And if there is, I can say yes, they had one. And the predicted score, so I'll just say greater than. So the next part then is the investigations, is the bloods, is the labs. So if the patient has had labs done in the past 3 months, these fields will be auto-populated. So the results will automatically be put in here. But in this example today, this patient hasn't had bloods done in the last 3 months, so they're all blank. And in your own surgery, in kind of a regular kind of a practice, if this is your first visit here, you're probably going to take bloods today. So you're probably going to leave this blank. You're going to take the bloods and you're going to send the bloods off, and then you'll come back and fill this in, or our Health 1 will fill it in. So we're going to leave this blank for the moment, and we'll move down to the thyroid function test. And again, this is the same as this above here, and this one here. You have your little icon here. It will search the file. It will say, is there any mention of a thyroid function test anywhere in Health 1 in this patient's file? And in this case, the patient has had one in the TS and the T3 and the T4 in 2017. So yes, they have. So we'll say yes to that there. And the same with the liver function test. So again, I can check the file. There is a liver function test done, so I can say yes there. So, and that's my investigations, but you can see there my investigations didn't turn blue there because obviously my labs are still waiting to go through there. So I'm going to leave that as it is, and we'll move on to the medication review. So we'll click on our medication review. So we'll say yes to that. They have had a medication review, and we'll put in the date. And again, like the rest of it, you can click the little tablet icon here, and it will bring you into Health 1, and it will show you their long-term active medication in here. So has the education been provided by the GP? Yes, it has. Have they been referred? Yes, they have. And then the details, and then agreed with care. So we'll just say declined there. So again, my medication review has turned blue. My fields are all blue here, and I've completed it. And there's still 9 fields required here. So I can't submit this. If I try and submit this, it won't allow me to. It will, obviously that's not a GMS patient, but it will prompt me to say there's fields required here. And that's just my blood fields. That's just the labs that I'm waiting to take. So at this point, you also have the care plan here, but we probably wouldn't do the care plan today. We'd probably go off, take the bloods, wait till the patient comes back in, and then on the set, maybe on visit 2, then we might do the care plan. So I'll just briefly run through the care plan with you. You can see that it's in blue because it's not mandatory, so you don't have to fill it in. We'll just have a quick look at it here. So you just put in the name of the carer. And then just say no there, and you can fill in. You can see there's a lot of information in the care plan that can be filled in, so you can fill in some details there, etc. So I'm not going to waste your time filling all that in, but just so you know that that's there. Actually, look for this once I start it. And now, oh, it's one more field on it. Yeah.
That's great that it updates as you go, Brenda. Yeah, very good.
Yeah, exactly. Yeah. Yeah, so that's pretty much the Mediform in a nutshell there. So I'm going to save the Mediform here now, and I'm going to go away and I'm going to take my bloods. So I'm going to press save here, and so we go up to our lab request. So we have our insert lab request, as we would do if we were normally taking bloods for any patient. So we're going to click on insert lab request, and you can see there we have the lab request management. And what Health One has done, which is really nice, is if you click on the drop-down selection list here, you can see you now have a chronic disease management selection in that list. So if I click on that there, Health One will automatically look at the conditions in the problem list that are registered, and it will automatically tick on the bloods that are needed for those conditions. So it's pretty much doing it all for you. It's really nicely kind of managed here. So I don't have to change anything here. The correct bloods have all been selected for me. All I have to do is go over here and say who done the blood. So if this was the nurse or the doctor, I ticked it on here, and I would say whoever it is, and it will automatically tick on today's date as done by. So I'll press OK. So that's my bloods ordered in the system. And then I'll send the bloods away. And then obviously, you know, probably a week or so later, like I was saying earlier, the bloods will come back in, and the doctor will probably do the second visit. So he'll do the review, he'll check the bloods, and at that point then you'll probably submit. So just to say as well, if in the interim at any point the patient develops an additional condition here, what you can do is you can go up to HCR, and actually, where is it? Sorry, now I've hit a blank here. Oh yeah, if we go down to, sorry, it's HCR, and we go down to chronic disease management. At any point at that stage, we can go in and we can add an additional condition in here. So we can tick on another condition there, and it will automatically then, when we're doing the next part of the review, it will automatically have that condition as part of that review. So just to mention that there. So the next thing we look at now is the dashboard. So the dashboard where we will manage our submissions and our rejections, and we'll just be able to check everything that's gone from Health One and the results that are coming back in. So we'll go up to our analysis, and we go down to chronic disease management dashboard. So it's very like the cycle of care dashboard that you'd all be familiar with, but it's now the chronic disease management dashboard. So when I click on that there, you can see in here now, so I have 2 patients that are waiting to be submitted here. You have the submit button, you have an export option, you have a refresh. You can filter within a certain date range, so you could take that on there and look at any submissions that are in between a certain date. If you click this little icon, you look at the week or the month or the year. You can filter by responsible or GP number, doctor in charge, patient, disease, patient age, and then submit status, which is probably your main one over here. So you can see anything that's not submitted is in this kind of beigey kind of a color here. When they're sent, they will change again. Obviously, I have a dashboard because I'm in a test system. I can't actually submit anything from here, but I'll show you on the PowerPoint just what it looks like when you have a proper kind of a dashboard. So you can see there the ones that have been submitted they're in that kind of green color. So they have been submitted and they have been accepted. So the result is back and the claim number is back there. So that's what your dashboard will probably look like. I think that's pretty much it. Let me just make sure I've covered everything.
That was great, Glenda. Sorry, just while you're doing that, if anyone has any questions, there's a questions tab on the right-hand side of your screen. It should be in the toolbar. If you want to just type a question in there, it'll come through to me and I can ask Glenda. But Glenda, I think that was a really comprehensive overview.
Good, I hope so. I mean, it's nicely, Health One has managed it really nicely. They've made it really easy for the GPs to be able to go in and out of the chart and look at previous information that they might have, you know, stored in there. So they don't, you know, it's nicely managed, I think.
That's great, yeah. And look, for everyone here, this webinar has been recorded and we'll be adding it to YouTube. So probably tomorrow you should get a link with, an email with a link to the webinar on YouTube and also to some user guides that we have up on our website for you guys as well, just to make things as easy as possible. But again, if anyone has any questions, just feel free to get in touch with our support team, and they're happy to help.
Donald, do I have time to run through the certificate, or do you want to wait till another day, or will I do a brief run of it now?
I think we might hold off on that, Glenda.
Okay.
sorry, I'm doing two things at once here.
Conscious of
Look, I think
Yeah.
we might hold off on the ecerts and do it on another webinar. And just
Okay.
to let the audience know that if anyone is submitting ecerts today, the service will be down from 4 p.m. So the DEASP have asked us to let you know that you won't be able to submit ecerts from 4 p.m. on today. They're hoping to get it back up tomorrow morning, but we will send you an email out shortly just with that update as well. So I'm just seeing a question here. Can we get your PowerPoint slides, Glenda?
Yes, that's no problem. If they want to send me on if they can send on their email address and I can email it to them.
No problem at all. Yeah, or look, yeah, we might see if we can pop that into the mail that goes out tomorrow as well.
Yeah, or if you want to give them my email address, they can email me and I'll respond back. So my email address is Glenda, glenda.oneill@clanwilliamhealth.com. So if they want to email me, just say I need the slides from today. I'll be happy to send it on.
Brilliant. That's great, Glenda. Hopefully that helps.
Yeah.
Yeah, so look, I'm sort of conscious of time today. And sorry, another question. When is the Metaform up and available to complete? Do you know, Glenda?
Sorry, when is the
Mediform?
Oh, it should be there now. So you should have the Mediform available as long as you have the correct version.
Okay.
So you need to make sure that you're on version anything above 8.7.1.26. So 2.6 or above, and the Mediform is available there now. If for any reason you're on an earlier version, just go to Help and Web Update, and that will update you to the latest version.
Brilliant. That's really handy.
And just make sure, while you're doing it, just update all computers while you're there, because you will need to do that for the social welfare cert. So, if you're going to update one, update them all.
Sure. Yeah, that makes sense. And sorry, another question just coming in now. If they don't use the problem list, but they always use medical history, how does this pull in the conditions?
It will still do it. It will still pull the conditions in. It's looking at medical history or problem list.
Great. Excellent. Yeah, look, listen, as I said, I'm just conscious of everyone's time and everyone is very busy at the moment. So I think we'll wrap it up there, Glenda. And as I said, we'll to YouTube as soon as we can, and we'll send you all an email with the link to the video and the link to some other guides probably tomorrow at this stage. But look, thanks again everyone for all of their hard work during this time, and thanks a million for joining us today.
Thank you.
Thanks, Glenda. Bye bye.
Bye bye.